everyone. I'm Christine Johnston, Engagement Programmes Manager with Healthcare Improvement Scotland Community Engagement. Welcome to our webinar on community engagement in primary care. We're really pleased to have everyone joining us today and delighted to be able to share some of our experience of the ways that people have been involved in primary care services. A couple of logistics before we get started. To help with sound and picture quality during the presentations, we've muted your mic and turned your camera off. So please could you keep it that way? It just improves on the sound and picture quality with so many people joining in. We'd encourage people to use the chat box throughout the presentations and the discussions, and we'll answer questions throughout the course of the webinar. Any questions we don't get around to, we'll certainly make sure that they're answered, and we'll post those on our website. And we'll also post details of the webinar on our website and any information about up and coming events which you can book online. We will be sharing the presentations and slides and the recording of the webinar as well. So just on to our presenters for today, are the people that are sharing the information. I'm joined by my colleague Chris Third, who currently works as an engagement officer in Grampian. And I'm saying currently because Chris is moving on Monday to a new role within our public involvement team. There's also some colleagues joining in from across Healthcare Improvement Scotland Community Engagement, and some people that are helping with the technical side of things. So I'm grateful for their help with that, namely Linda and Richard. And an extra special welcome today to Joan Duncan, who is a patient participation group member, and Leonora Montgomery, who's a community representative. And throughout Chris's presentation, we're going to be hearing a little bit from Leonora and Joan about what their experience of engagement is. So a very warm welcome to you, to both of you. And I'm conscious that everybody's, or most people are joining with some excellent weather going on outside today. So we will stick to time and let you get away and get out into that beautiful weather at 3 o'clock. So without further ado, can I hand over to Chris?
Hi, Christine.
Hi,
Thanks
dear.
very much for that.
Thank you,
that
Chris.
introduction. So I'm loading up my slides. Everyone should hopefully see the presentation coming on screen in a moment. If you don't see it, please do let us know, and I'll try and get that sorted out. So as Christine said, yeah, my name's Chris Third, and currently an engagement officer for Healthcare Improvement Scotland Community Engagement. And yeah, and I'm delighted as well to be joined today by Leonora and Joan, who are going to give a bit of their perspective as we go through the presentation. So so you're lucky. It's not just listening to me for 40 minutes. It's a bit more variety than just that. So first thing I'm going to cover is a little bit about the the focus of this webinar is community engagement in primary care, and there's the new Planning with People guidance that was out just there in March, that hopefully some of you will have seen, and if you've not seen, you'll have a link there in the chat box that'll take you to that, and you can have a look and have a read through that yourself. So kind of starting off with a question here: why should people working in primary care engage with their patients? So I've got a wee quote. I'll just read it out quickly, and this is from the Planning with People guidance. It says this guidance applies to all care services for children, young people, and adults. It should be followed not only by health and social care providers, but also by local, regional, and national planners, special boards, and all independent contractors and suppliers, such as care homes, pharmacies, and general practices. So the new guidance that's come out in March, it certainly applies to all aspects of service provision, and the guidance has been developed by the Scottish Government and COSLA. So it's been designed in partnership with the two organisations, with input from health boards, health and social care partnerships, and communities across Scotland. But guidance or legislation or whatever else, it certainly shouldn't be the main reason really that people engage around about their services. Engaging with people that use your services can lead to an overall improvement in the quality of the service that you provide. And it can result in more efficient services that work better for patients and for staff as well. It can reduce wastage, it can reduce time taken, and it can reduce expenses as well. Um, if people see that services are improving, especially when they've been involved in that work and in the work to develop and improve the services, then they'll be happier with the services that they receive, and they'll be more willing to engage in the future as well. It helps you to build trust with the communities that you provide services for. Um, and staff can play an important part in the engagement activities and should, of course, be part of the engagement themselves. When staff play a more active role in decision making and engagement activities, it also helps to build trust with their relationships with the organisation that employs them. And I'm just going to throw in a wee bit here because I just had a conversation with someone earlier today around about community engagement in primary care, luckily. And I'm not lying, honestly, I did have a conversation. Just an interesting point that they were making around about some changes happening to them locally, and that they were they'd been a bit disappointed that engagement hadn't taken place earlier, and that different methods hadn't been used, so there was some engagement, but not necessarily accessible for everybody. Um, and then the thing to say on this is that it it leads to it leads to a little bit of distrust forming if people aren't involved early on in the start, and it leads to complaints. So while yes, you need to invest time and engagement, I think the point that they were trying to make was if that time had been invested, then some complaints and things like that could have been avoided. And sometimes dealing with those complaints can take a long time, and you might have to do it for several individuals rather than just one person. So it was quite a good point that they were making. And they weren't necessarily happy with the decision, and that's fine. People aren't always happy with the decision, but it gave them two things to be unhappy about. They weren't happy with the way that engagement had taken place, and they weren't happy with the way that the decision had been made. So there were extra things there for them to pick up on, and it just leads to more confusion, more delay, and more sort of hassle, I suppose, for everybody involved, patients and services. So it is worth remembering that actually that early engagement, it might feel sometimes like it is time consuming, but actually it can save you time as well further down the line if it's done well, and if folk have had a genuine chance to have a say, and they're also more likely to be happier with the outcome. And I'll come on to a little bit more about that later on. So yeah, just to kind of cover, I've actually already kind of gone over some of this, but why should people working in primary care engage with their patients? Well, it results in better services, which are more efficient and reduce waste. Patients are happier and staff are happier. Um, so to talk now a little bit about one of the methods that it's maybe not the most common method, but it's certainly a method that is used across Scotland to engage with patients, and that's to have a patient participation group. So a patient participation group is generally members of the community and practice staff working together, engaging with the wider community, planning services together, improving the health of the community. And as well, it's worth noting that during the pandemic, groups have met digitally as well. So some groups have kept going. So patient participation groups include a good mix of people from the community and practice staff, and anyone can chair the group. So it could be somebody from the practice, it could be a volunteer though as well. And in fact, often the chairperson is a volunteer from the community. It is important that the group works well together, and many groups have a constitution or a terms of reference to kind of help them keep on track. And meetings tend to have ground rules as well. Everyone should understand the objective of the group and the role that they will play in the group. generally, patient participation groups support the practice to engage with their wider community and gather feedback as well. So it's not just the people in the group that are giving their opinions, that the people in the group are working with the practice to reach out to that wider community and explore ideas for improving services or help to engage around about changes being made to services. And many patient participation groups have also organised events and talks around key health issues and topics within their community. Helping out during the flu clinic, that's another kind of quite common one, probably maybe a bit less with the recent changes, but certainly up until recently, it's been a role for where patient participation groups have helped out with the practice, health fairs, things like that as well. So the groups can do some engagement activity as well, so they can help out with with surveys, with conducting surveys, helping to facilitate public meetings, helping at stands at events and things like that as well. So one of the ones I quite like to go along to and see how the group's doing up in Keith is heading off to the Keith show. It's quite a nice one. I quite enjoy that. And really engaging with patients there. They can really undertake any activity that they feel will meet their objectives, which would be agreed with between the group members and the practice, so long as they've got the capacity and the skills to do it. And yeah, that there has been, with the pandemic, there have been many of the activities have been sort of put on hold for many groups, and things certainly couldn't take place in the circumstance and under the circumstances. However, that said, there's still there in some other ways that's led to some opportunity with other groups moving more towards using things like social media, Facebook or meeting online and things like that. So although it's presented challenges, it's presented opportunities too, and some of that can lead to a wider engagement as well that maybe wouldn't have been achieved by the methods that the group had previously used. So there's certainly some opportunity there. So, Joan, you're a member of a patient participation group. Could you tell us a little bit about your experience of that? Joan, are you with us? Are you having maybe some technical problems?
Sorry.
That's all right.
In control now, I think.
Thanks, Joan.
Right. Yes, hello everyone. I'm a founding member of Stonehaven Patient Participation Group. We've been running 12, 14 years maybe. Over the years it's developed and the relationship has become closer, although I think it still has a way to go. I think that members of a patient participation group should be seen as critical friends, as it's in everyone's interests to work together in tandem for the good of both the doctors, the AHPs, the staff, and the patients. Our group has held some very successful and well-attended health educational evenings, and patients have found that to be really helpful and informative. And it brings them into the surgery, not just when they have health concerns. I think it's a good idea. We've held children's asthma evenings, CLAN, Alzheimer's, several CPRs, and actually I think we could hold one really regularly because they're really well attended. Beg your pardon, there's my phone. Oh, sorry, I will just have to bear with it. I can't stop it. Anyway, yes, they've been made a huge, PPGs can make a huge difference in making practices informed of the concerns that patients have, and they can also be a forum for suggestions on the way that practices can work better for the well-being of all. I don't think that GPs are quite there yet. While I appreciate how hard-working everyone, how hard everyone is working, the patient's interest should always come first. And I'm not convinced that that's always the case. And I think that the pandemic has brought some of these issues really to the top of my concerns. On the positive, at the 70th birthday, the patient participation group held a great big party and many people came along and we got more people joining. So that's my experience.
Thanks for that, Joan. Thanks for sharing that with us. So I'll head on to my next slide there. And going to talk a little bit now about other ways to engage with patients. So of course, social media has been used before the pandemic, but it has become much more common. Questions and surveys have been used by practices, public meetings, and gathering feedback directly from patients. But there definitely are many other ways to engage with patients. You don't need to have a patient participation group to do that. Although and it isn't a requirement. So there's not a requirement to have a patient participation group. Although, you know, we would suggest that you would, if you are providing primary care services, that you do look into it. It certainly can be a really positive way of engaging with people and involving people in the work that you do. Social media has definitely seen an increase. I think I've noticed myself, even just locally, that there's quite a lot of practices have set up a Facebook page themselves to engage with patients over during the pandemic. So, and many of them had before. So, you know, Facebook's quite a popular one there. And it does allow a decent measure of control. So you know, you can set features, you can display ground rules on it. You know, you can monitor it. It doesn't tend to necessarily meet a larger a younger audience. It doesn't tend to fit up with them so much, but depends on how you read into it. With stats and everything, Facebook's still the most commonly used social media app. So you know, there's definitely merit in if it's somewhere to start. And Twitter has been used as well. I think more recently too by practices. I've certainly seen more practices setting up Twitter accounts as well. Again, maybe not quite so popular with younger folk or whatever. But certainly definitely does increase your reach. Yeah, if you were going to look at other social media platforms, you would probably be thinking about things like Snapchat and that for sort of reaching younger folk. Instagram maybe to some extent as well, and yeah, even TikTok. That's the new one. Don't know what that reaches as yet really. Social media can be a really useful tool for sharing things like questionnaires and surveys and gathering views as well. So it does have a great use for that. And you know, the same surveys and questionnaires could be used in the practice as used on social media, for example. So you know, once we're doing more things face to face again, the Facebook page won't become obsolete. You know, you'll be able to do a survey in the practice, but you can use the same survey you know, face to face in the practice. You could use the same one online as well. So yeah, and thinking beyond that as well, so not everyone has access to social media. So something like a survey, it could be done over the phone if you did have the time to speak to some folk over the phone that maybe couldn't engage with social media. So you know, there are always going to be folk that maybe won't necessarily be able to engage with one method. So if social media doesn't work for people, there's another thing to do. You know, you can email out the survey, you can have a telephone interview, things like that. As long as if you know, got those details from patients, you've got folk that are willing to speak to you about things like that. And public meetings, they're not obviously common at the moment, but you know, once things hopefully get back to a bit more normality, it's a great way to involve a large number of people within your community, and speak to them at an early stage about changes that could be made, and see how people feel about those, getting other suggestions and things like that. It's a really good way of it's particularly good for delivering information as well. So if you are at those early stages and you're wanting to outline a potential change, then a public meeting would work well. It wouldn't necessarily work well as an ongoing engagement method if that's the only thing you're doing. You have to think about other ways to involve people that might not be able to attend the public meeting. Obviously, that's a meeting at a set time and place. Not everybody's necessarily going to be able to attend that. It doesn't suit everybody's needs, but it certainly can be a helpful method. Of course, as well, another way of engaging with patients is just to do it directly. So if folk are in for something, and it can be anything. They could be in for a GP's appointment. They could be in to see the nurse or the phlebotomist, whatever it happens to be. Or if you're a pharmacist, they could be somebody that maybe you see a little bit more regularly coming in for advice and support. There's no harm in just asking if they've got a few minutes to answer a couple of extra questions or have a wee chat, so long as you build that into your time, and you're able to do that. So I just wanted to, Leonora, I've just got a wee question for you now. You've done quite a lot of, you've been involved in community engagement online digitally for quite some time now. Would you like to tell us a bit about how that's gone for you?
Well, on the whole, it's gone very well. You do get glitches, as you're aware. I had a bit of trouble, NHS Grampian side, getting it into the meetings to begin with. But I think that's more or less resolved itself now. But it is, it's enjoyable. It face to face, you've got more social aspect of it. But I have to say that I think that social media will be here for a long time yet. Meetings, a mix of both, I would think, depending on the meeting. But and it does tend, in most cases, to make the meeting shorter in some cases, which I'm eternally grateful for at times. But on the whole, it's worked really well. And as somebody said, it's a new norm going forward, But as I say, I think it'll be a mix of both for some time to come.
Thanks, Leonora. Absolutely. So I'm going to speak now a little bit about the importance of kind of closing the loop, giving that feedback. A vital part of engagement work is telling people what you've done as a result of their feedback. So it is really about that kind of, as I say, closing the loop. And even if you haven't made a decision that the majority of those you've engaged with support, it could be an unpopular decision. It's still important to give that feedback. The thing with the feedback as well is that it helps people need to understand why a particular decision's been made, and it helps folk to do that. If you set out why you didn't take a suggestion forward, if you set out why that decision had to be made the way it was, there can be very valid reasons for that. But if you don't tell people, then they won't know. They'll go away. They'll be left thinking, well, what happened with all of that, and they'll be less likely to engage again in the future if you're not closing the loop with them. And folk need to understand as well what they can do next. So sometimes, maybe they might have further concerns. They might want to raise that or have a chat with somebody about it. And I think it's much better to do that in this way. Giving people feedback, telling them why the decision has been made, and give them an opportunity to maybe ask some further questions, rather than, as I said before, having to deal with a formal complaint. And folk need to know what they can do next. So they might have some options there, and it's good to let folk know if there are options. And if engagement has been open, honest, and transparent, then people will be more likely to accept a difficult decision. That's often the case, that just being open and honest about the decision that's been made and the process that's that, and how people's involvement have actually helped to make the decision. Because even if the decision isn't what most people want, it's probably what some people will want, and it's also probably been influenced, and hopefully it will have been influenced by the engagement, by people's experiences, and explaining that to folk, will help them to understand that it's a difficult decision. It was a difficult decision to make, and why that decision was made the way it was. So, Leonora, I'm going to ask you another question here. Do you agree that it's important to give feedback to participants, and what's your experience been around that?
Oh, I think it's vital to give feedback, because especially if it's a complaint, because it just escalates from there if you don't give proper feedback. And as you've rightly said, to give a proper decision, explain to people why the decision, be open and transparent about it, and it goes a long way to diffusing the situation if you make them understand why the decision was made as such. Other organisations I'm involved with, actually, very poor in communication. But I think the NHS is not among them on the whole. They're very, very good, really. But if they keep that going,
Thanks, Leonora. Thanks for your insights into that there. So I'm going to talk a little bit more about the support that Healthcare Improvement Scotland Community Engagement can give to people working in primary care, and that you can access, and you can that's the thing, there is support there for community engagement in primary care, and it is open to anyone working in primary care. So although a lot of our resources maybe are originally designed for GP practices, they can be used by anybody as well, and also support from engagement offices. Anyone can access that. So I think there's some links going into the chat box there for some of this stuff. And so, yeah, engagement office staff, yeah, we can provide a lot of support to staff working in primary care, but as well to groups themselves. So as I said earlier, many patient participation groups are actually led by community members, and we can provide support directly to the group if the it would obviously be through discussions with the GP practice, but it could be that group members are requiring some additional support or training or something like that, and we might be able to help with that. So one of the things that we have done in the past with patient groups is we've got a development tool on our website, so it's in the participation group section there that I think Richard's put the link in, and we can run through the development tool with existing groups, and that really aims at that's really aimed at supporting groups to look at the work that they've done, and also to think about what they want to do in the future. So it's just a wee exercise that, if you want somebody that's not part of the group to come in and do something with the group and help you reflect on the work that the group's been doing, then that's open. You can use it yourself, so you can download it from the site, or you can ask. We're happy to support groups to run through that tool as well. And we can support practices to set up new groups as well. So that's definitely something. There is a startup guide on the website, but if groups are wanting some support for those first couple of meetings, then it's absolutely something that engagement officers can help you with. And things as well, like looking at terms of references, group agreements, ground rules. If you don't have a lot of experience in these things, that you don't know where to start, and engagement officers can certainly help with that. And there are examples in the tools on the website too. But if you wanted to speak to somebody, your local engagement office is there. There's quite a lot of other tools on there as well. You can have a look. You can have a look for yourself. Go through things, and you can speak to your engagement officers as well and see what support they can provide you locally. And one of the things that we can do is Voices Scotland training. So that's a programme that was originally developed by Chest Heart Stroke Scotland, and engagement officers have been trained to deliver that training. So we're actually in the process at the moment of kind of getting a digital version up and running. So hopefully that won't be too far away. And it is designed at supporting community members to get more involved in the work of the NHS and health and social care. So it is quite targeted at them. But we've got but we've had sessions where people from partnerships have been along, and that's gone really well as well. And I think folk can get quite a lot out of it from hearing what community members are speaking about, what questions they're asking. The other another couple of things to mention quickly is a participation toolkit. So that's on the there's a section of our website for that, and quite a lot of tools on there to help you think about the different methods you might want to use to engage with people, but also for giving feedback. So some of the methods there are also more focused on the sort of feedback element too, so or gathering and giving and sharing feedback. So yeah, there's a little bit on there around that. And voice support as well. So we do quite a lot of I work with other organisations, and one of the bits of work that we did was you might have heard of the Scottish Community Council for Community Development, SCDC, as it's known, too many acronyms. And they've developed with the Scottish Government the national standards for community engagement. So a lot of the stuff in planning for people is based on that as well. And there is an online tool called Voice, which not to be confused with Voice of Scotland. I didn't name either of them, so I'm not taking responsibility for that one. But yeah, vision and outcomes in community engagement, and that tool helps you to plan your engagement activity, and engagement officers have been trained as trainers for that, so we can provide support to people using the voice tool, and it's recently been updated and streamlined as well. So actually, the new version I think actually went live this weekend, although I'm saying that with a bit of a maybe it did, because I haven't actually gone on to check it yet. I should have done before now, but yeah, I think it was over the weekend it went live. The new tool went live, so that'll be quite interesting to see what a difference that makes. It has been streamlined quite a bit, so in response to feedback from people that were using the previous version of the voice tool. So I just want to ask Joan another question here. We have done work with your patient participation group in the past, Joan, and I wondered if you just wanted to share a little bit about your experience of that.
Yeah. Yes. I think we'd been about 4 years old when we seemed to be kind of stuck in a rut, and so I can't remember whether it was our chairperson who's a member of the community. Anyway, in discussion with the GP that was in charge at the time, we reached out and you came out, and we had it was very useful, and we then did a video which I think you still use, Chris. I'm not sure. So things went along swimmingly, and then recently we had some challenges, I would say. So read the Constitution and the Code of Conduct, and so the current chairman reached out again, and yourself and Gosia came, and that was a Zoom meeting, and that process is still ongoing. So yes, I think that the assistance that we got really helped greatly. 2 different things, but it was very useful.
Thanks for that, Joan. And yeah, and you mentioned the videos there, and there are actually, although they are a bit older now, there are actually a wee suite of videos on our website there that do share experiences from patient participation groups. So there's quite a few. I think there might be 6. I'm trying to remember if that's the right number, but I think it's 6 videos that we did, and yeah, featuring Stonehaven as one of those. So moving on to the next bit, I just wanted to talk a little bit more about a specific piece of work that that we have done recently. So we held an event which we decided we would call the Grampian PPG Blither. And we held that at the end of May this year, so the end of May 2021. And it was really just, we did it as part of Patient Participation Group Awareness Week. So that's usually the first week in June. So it included the 31st of May. So that was when we had the event. So we usually try and do something in the Grampian office to mark PPG Awareness Week. And we had done the previous year, we had run a national networking event in November 2020, and that was quite a good piece of work to do. It was national, but because we'd done that, we kind of felt we'd quite like to do something local, for more aimed at the groups locally. So yeah, it was primarily aimed at patient participation group members and practice staff. And we had a nice wee number of attendees. So it wasn't a huge group of folk. There was about, I think, 13 folk, excluding us as the kind of hosts. And it was a good mix of folk as well. So there were community members, but there were members of staff along as well that were involved in their groups locally, or some that actually didn't have a group and were thinking about setting up a group as well. So it's a chance for them to find out a bit more of it. And that's what we wanted. We didn't want it to be too big, and we wanted a decent mix of folks. So that's what we got. So I was really happy with that. It was about an hour and a half, and we did have a wee break in it in the middle there. And the main aim of it, the event, was really just to share share folks' experiences and have a wee chat and ask questions and find out what other groups had been doing, over the last couple of years. And we heard some really good experiences, some really good ideas from folk, some really interesting things that people had been working on during the pandemic, and hopes for the future as well. And following the event, the feedback was really positive, and folk told us they would like to do it again. And the popular suggestion was maybe having it twice a year. So we'll look at how we might take that forward, and maybe arrange something for some time near the end of this year or the beginning of next year. And I think that's something, that as engagement officers, we have connections with all the kind of groups in the area. We have contacts for all the practices, and we can bring folk together for wee events like this. And it doesn't have to be a massive undertaking. This session was an hour and a half, and there was some folk that maybe just attended the first half or whatever and couldn't stay for the second half, and that's fine, because folk have stuff on. We realize that people are busy, but hopefully for everybody still get something out of it. And as I say, the feedback was positive, so it seems like we did a good job with this one. And it's certainly something that, like I say, in Grampian would be keen to repeat again, and hopefully kind of keep that going. And again, these sorts of things, can discuss them with your engagement offices, and see what you can do. Bringing together a bunch of folk. It could be engagement office led. It could be led by the patient groups themselves. However you want to set it up, certainly worth having a conversation if it's something that you'd be interested in. So, Joan, I was going to ask you another question here. You attended the event that we held in May. Can you tell us a little bit about your experience of it?
Oh, yes. I thought it was really, really a very good event, and because I think it involved patients and practice staff, practice managers. There was a GP and other health professionals. It was very open and inclusive, and we heard of the challenges and the opportunities that everyone had. I thought it was excellent. I learned a lot from it, and I certainly would want to do it again.
Thanks for that, Joan. Thanks for the feedback there. So yeah, absolutely. It was a good event to have. I did want to talk a little bit as well about, before I kind of move on to the next slide, I did want to kind of think about the wider around about health and social care, and that, you know, it's not primary care services. They're not necessarily, you know, they're provided by lots and lots of different people, and Leonora was involved in part of the project to create a new health village here in Aberdeen. It's many years ago now, but I just wondered, Leonora, if you wanted to say a little bit about your experience of being involved in a larger sort of scale project like that, looking at a community health hub.
Yes, I was really proud to be part of that. I can't remember how many years ago it was now, but it was quite a few. But it was amazing, you know, from seeing it from the very beginning. Two of the members got to dig the first piece of earth out of it, which was quite exciting, you know, because we all enjoyed that. But on the whole, I mean, through the project, we had regular meetings, updates, see how things were going on, and we got asked about, excuse me, to the colour scheme we had to decide on, very important, and the signage, of course. And it culminated with being invited to the opening ceremony, which Catherine Granger came along. She wasn't Dame Catherine Granger at that time, if I remember correctly, but we got introduced to her and had a word or two with her. So that really, you know, finished it off nicely for us. And as I say, I'm proud to be still say to people, oh, I was part of that, you know, but until they complain, and then I keep quiet. You know? But no, it was really, really good.
Thanks for that, Leonora. And I think that's, you know, that encapsulates what a great experience community engagement can be for folk, getting involved in it and being there, like as Leonora says, you know, from the very start of a process to the very end of a process, and seeing it developing over years. I mean, that project was a good few years in the making. So yeah. It can really have a very positive impact on folk that are involved in that process, and they can share that, you know, with other people, as Leonora has done today, and then folk really can understand the difference that can be made through good and robust community engagement, and from the start of a process, and that's important. I think that's a very important part, that folk are involved from an early stage, as early as possible, when you are thinking about making a change or building something new, or whatever it happens to be, any aspect of the services that you provide there. So I had a few slides about an event, about the November event, but I think we're kind of running a wee bit short of time, so I think I'll just kind of summarize it very briefly. In November, yeah, we had this larger event. It was based off in Grampian. Like I say, we'd put on events previously, so we'd done a couple of events. We'd done one that was an entire Grampian event that was a wee bit of a bigger thing by video conferencing many years ago, before we all had Microsoft Teams on our laptops and things like that. And then we did another one that we decided to came up with a way of linking it together by Twitter. So we did one a few years later, and we included colleagues from Tayside in that as well. So we went a wee bit wider. And then last year, we'd been planning it before the pandemic, so it was originally going to be like PPG Awareness Week, June 2020. But you know, with the pandemic, it knocked everything a wee bit. And we were planning that as a partial digital, partial face-to-face event. But we changed our plans quite quickly once we started planning it at the end of 2019, and then you know, 4 months later, everything had changed. So we kind of dropped the plan. We didn't really do anything with it for a wee while, but then we picked it up again and brought an event, a plan for an event together. And proceeded with that. So a totally digital event on Microsoft Teams. So it was quite a big undertaking to plan that, to get speakers organised for the day, to yeah, and we did a lot of things. So, you know, some tips out of it from the event that probably is one of the most important things to share is that, you know, it does take a lot of, for a big event, for a big national event, it does take a lot of preparation. Now you might not be doing something like this if it's a local thing, but but there's definitely some tips for digital engagement around about things like creating a script with a running order. So we had quite a detailed wee running order there to tell everybody, with times in it. So this happens at that time, this happens at that time, etc., etc. And that was a really useful tool for us because everybody knew what they were supposed to be doing and when they were supposed to be doing it, and had all the links and everything they needed in there for the folk that were helping to facilitate and present. And the event run very well to time. We were quite we weren't sure what to expect, would sessions be overrunning or whatever, but we actually managed to keep it really well to time. And it was over a whole day. We had 5 sessions across the whole day, and folk could attend what they wanted to attend. So it worked really well. And it certainly supported groups to make more contact. We got folk getting in touch with us after the event and asking for a wee bit of support. And I believe other groups, made some contacts with each other as well during the day. So there certainly was a bit of that. Probably a bit less than maybe our local one when we had the PPG Blether. I think there was a lot more sort of interaction then, but that's what you would expect. It was a big national event with lots of folk attending. So there's pros and cons, I guess, is what I'm trying to say, between having something more local and something a bit wider than that. And it's just about balancing the two together. Feedback was really positive. It was very positive, and it's certainly something that I think there were certainly some things raised as well that we'd consider in the future if we were doing a larger event. So there were areas for improvement still, and we did get quite a lot of feedback, so that was good. It's always good to kind of get that feedback yourselves, and that's that is important. One of the important things to be doing when you are carrying out engagement activities, to be evaluating it, and learning from that so you can improve for the future. So that's me. It was a kind of very whistle-stop tour of the community engagement and primary care event that we held in November there. And I just wanted to, before I get questions, I know I'm a wee bit over time with the presentation there, but I just wanted to say thanks again to Joan and Leonora for sharing their experiences today. And over to Anne, I think. Is there any questions there in the box? Or Christine, sorry, did you want to come in?
I can come in, Chris, just to thank yourself very much for the presentation and all the information you've shared with us there. It's really good. And again, to Joan and Leonora for sharing their experiences. It's music to our ears to hear about positive examples of engagement where people have found those fulfilling and they've helped to shape the services for others. I wonder if I think the chat box has been broadly answered as we go along, but is there anyone with any questions that want to come in, or I'll invite maybe Anne, because I know she's been monitoring the chat box a little. So I'll come to Anne in a minute, but Ali, you had your hand up really quickly there. So let's take a question from Ali.
I think, sorry, please excuse the background noise. I'm Ali Mehdi. I'm the Vice Chair of the Scottish Health Technologies Group. It's a real privilege to be with yourselves and see these outstanding pieces of work in primary care. By background, I'm a consultant orthopedic surgeon based in NHS Borders, so it probably sits slightly outside what the current discussion is, but I think it's equally relevant to primary care. So through the pandemic, it occurred to me that there was a good opportunity through all the online clinics that I'd been doing, online and of course phone clinics, to set up a simple survey on Microsoft Forms. So I just wanted to sort of share the learnings from my whole journey about how to collect patient feedback. I thought it would be very useful because what's occurred to me over years and years is that any sort of transformational activity that we're doing, we've liked to have had patient representatives, but they probably represent the very tip of the pyramid, if you like, of opinion. So it occurred to me that how do we involve patients on a bigger scale? So I thought, why don't I test out Microsoft Forms? Because I've gathered again that we are limited in the usage of the type of survey tools that we can use. Because I understand that Google and SurveyMonkey have their servers in Dublin. They're not based in the UK, whereas Microsoft has a server based in the UK. Hence, we can sort of store NHS information on Microsoft clouds. So I set up a Microsoft Forms, and now I've been 3 months, and I do an online clinic for about 8 people at a time. now we're 3 months into this journey of, or 4 months even into the journey of collecting results. Now, of the 100 odd patients that I have sent the form to, I have to say that disappointingly, as you'd expect, I've had 35, 36 responses. So my standard is I'll see somebody online and then say to them, look, I'm going to send you physiotherapy links, some links for splints, etc. But by the way, could you please help me and understand, how good this whole service has been, the video aspect, the technical aspect, and of course the consultation aspect. So at one level, I have found that the response could be better, but on the other hand, I think there is a digital divide. There are people still using, I have to say, ancient email addresses such as btinternet.com. You can see the age demographic through that. btinternet.com kind of thing is 60, 70, and the more casual ones are the more younger generation. So my generation is more Gmail, Hotmail. I'm in my 50s, by the way. Hotmail, Gmail, that sort of thing. So that's one interesting thing that's come back. But the other thing that I have found very empowering is that whatever else has come back has been very useful. So the vast majority of patients, I gather now, are quite happy being phoned or being seen online. There is still a big chunk who would like to be seen face to face from what I've seen. But more importantly, I have felt I've had very positive feedback, and that in healthcare is missing, because what we often get is complaints. We get SAERs, we get ombudsman things and processes coming back at us. Maybe, 1 in 1,000 patients, but we don't have data to capture how satisfied 99%, 999 patients are out of 1,000. So again, I wondered, and this is a question, sorry, I've been a bit rambly here, but I wanted to share my experience, but I also have a question. Is there sort of a move towards examining customer relationship management software? Could we not have that? So we go to the airport, we tick a smiley box. Could we not have systems that actually provide positive feedback most of the time, and then areas of improvement other times? Is there a sort of move? Is NHS Scotland seriously looking at that sort of thing? Because I think it'll be massive. It'll retain people, because it'll tell people how good they are and how much they're valued. And at this point in time, people are not in the best of place. And we need to sort of, think along those lines. So are there any thoughts on sort of developing, if you like, customer relationship management tools?
I think someone just shoved something in the comments box there about care opinion. So I guess in an ideal situation, care opinion is really aimed at gathering that wider ongoing feedback, and it is a space that's kind of there for all boards to kind of be using to get experiential data from folks. So it's a useful one if you are looking for something to refer folk to, have a look on care opinion, if or kind of spreading the word a wee bit about that can be quite useful. But no, I mean, I think your suggestion there is an interesting one. How do we do more of that, and how do we encourage? There must be some ideas out there for that we could use to gather that feedback ongoing.
Christopher, thank you. But the thing is that care opinion is a kind of empirical tool, right? And it, again, my experience is that not everyone complies with it. It's a bit clunky, perhaps. Maybe there needs to be something very instant, something that's very simple, easy to use, that can be translated into tangibles. And this is something that, I would be very keen to explore with whoever it is, whether it's yourselves, or maybe, this could be a potential project for SHTG to do with yourselves, to examine different types of customer feedback tools, because I think we are really going into that space. And there's a lot happening, mind you. There's a lot of transformational activity happening across Scotland at the moment. And NHS England has moved very quickly. So you've got the early cancer diagnosis centres, for example, very nimble-footed work. There is a lot of transformation regarding, clinics, regarding, if you like, outpatient services, inpatient services, and all that. And how do we get patient involvement as well in that sort of transformational change? So I think this applies to primary care pretty much as applies to secondary care as well. But, I really thank you for giving me this opportunity to speak. But it's something to think about, and I'd really like to encourage everyone.
Yeah, thank you very much for that contribution, Ali. It's most welcome. And I think as an organisation, what we do promote is that, we've talked about patient participation groups today as one method of engagement. It's not the only method of engagement. There's a variety out there. And as an organisation, we would also promote quality engagement over quantity engagement. So not about shoving surveys and bombarding people and trying to get everyone involved, because it's not everyone's bag at the end of the day, but we would promote that quality engagement. And I've noticed the chat box going up and down there. There's quite a lot of suggestions in there of people offering their time and other suggestions about what can be done to engage in primary care. So everybody that's contributed to that, thank you very much indeed. And Ali, I hope it'll be useful to yourself, and well done for keeping going with the machete on behind you. It sounds quite noisy, but hopefully it's a productive noise. We've kind of run out of time, so I do apologise for that, but we will answer all of the questions and the points in the chat box, and I've offered some email addresses on how you can keep in touch and get in touch, and a few people have said they will get in touch. So let's keep those links going and that chat going about primary care, of which we're passionate about public engagement in that.